All right, everyone, welcome here. We have Sherri. She's on our Utah Spotlight series for Best in Pelvic Health, and she has been a nurse for 23 years. She's an IBCLC for 15 and a myofunctional therapist for 4. She's also a mother of 6 kids, and they are her life. She is currently getting her FNP so that she can bridge the gap between dental world and medical world involving tongue ties. She is passionate about oral health, obviously, here. And so thank you so much, Sherri, for being on our Spotlight series. I'm excited to dive in on all the things with you.
Awesome. I'm so happy to be here and thank you for this opportunity. I always love talking about what I'm passionate about. So,
Awesome, awesome. Me too. We're in this together. So tell us what
yes.
made you decide to be a nurse and then an IBCLC and like what led you down this whole route?
Okay. Well, it's been a long road. When I was in kindergarten, I decided I wanted to be a nurse, and then no one could persuade me differently. When I was in nursing school, my whole focus was pediatric ICU, and that was where I started and found out it wasn't my favorite right away. Went on to maternity and work in the NICU. And then in the NICU, the lactation ladies had the best shift because they had a 4-hour shift. And I had just had my third baby and life was crazy. And I was like, I want their shift. And so when an opening came, I just jumped at it because I'd had a difficult time nursing my babies as well. And so I knew the difficulty that can come with that world and wanted to just help moms. It's what I'm pretty passionate about. And so I became an IBCLC. And then in the IBCLC world, I was like, wait, this baby is not doing well. But mom's got great anatomy, mom's got great nipples, mom's got a great supply. Like, why can't this baby get milk? So Anne and I deep dived into the tongue tied world. And then I realized that I was working with moms and babies with their tongue ties and helping teach them. And they would be like, oh my gosh, can you look at my 3-year old? Or can you look at my 5-year old? Or look at my mouth? Like, am I tongue tied? I rarely go through 24 hours without looking in somebody's mouth. And so my kids can't take me anywhere. But the thing is that the tongue tie oral function world is unfortunately really controversial, and I don't know why, but it is. And I was fired from the hospital for telling a mom that her baby could be tongue tied and she needed to go get help to get it looked at.
Oh no.
Because as an IBCLC, we can just assess and give suggestions. Like we're not a provider. We give suggestions to the mom and baby, the family, the dyad, and and just support them however we can on wherever they're in their journey. And so became a myofunctional therapist so I could help kids and adults with their tongue ties. And then we switched our name from Success with Breastfeeding to Utah Breastfeeding and Tongue Tie Center because a lot of times, at least twice a week, I hear parents say, I my pediatrician said my baby's not tongue tied. My lactation consultant said my baby's not tongue tied. Like, how come you're the one saying my baby's tongue tied? And so I go through a really thorough evaluation and they're like, I said, well, did your other provider do what I did? And they're like, nope. And I was like, well, then it's not that they didn't know your baby was tongue tied. What they were looking for wasn't there. So they assumed your baby wasn't tongue tied. So that's the long story of how I'm where I'm at.
Love that. Love that. Okay. What do you feel like makes you obviously like the training and the depth and things like that that you go into to assess these things? What makes you different from anyone else who's doing this kind of work?
Yeah. So we are a 2 IBCLC owned practice. That's very unusual. And because Anne and I are both NICU RNs, our training seems to be a little different. Our assessment skills and other things like that seems to be just a little more in depth. And we've been around the block a few times. I have 6 kids, Anne has 4. So I think the other thing that makes us really different is that we just care about the patients. Like I never want a mom to feel pushed into breastfeeding or pushed into tongue tie releases or the fear stuff that they send to moms and babies. Like there's just a lot. And I think the thing that makes us different is that we like, not that everybody doesn't care, but like we really care, and everything we do is about how we can help the patient have the best experience here, which has led us to a whole host of things that we do here that you wouldn't find at like a tongue tie center anywhere else. Um, but Anne and I have spent thousands of our own dollars and traveled the world listening to and learning from the best of the best. And we've done that, and it's not what a lot of IBCLCs do. So while there's an amazing, phenomenal IBCLCs and I love them all dearly, they just aren't trained to do what we do here.
Yeah. No, I mean, you have an extensive background, especially being with the nursing degree behind it all, too. And then the FNP that you're going for. So that's amazing. Thank you for sharing that. Okay. Describe who is an ideal fit now that you like kind of span the horizon of like generations, I guess, of like who's your ideal client? Who are the people that you're serving day in, day out, and that you love to like just be part of their life?
Well, basically, if you have a tongue, so birth to death, we do everybody, but I would say our lactation, like our breastfeeding side of things, is obviously new moms.
Hmm.
My favorite is when a mom comes in when she's pregnant for a prenatal, so we can
Hmm.
talk to her. And even if she's breastfed before, I mean, my sixth was my hardest nurser, and I'm a professional. This is what I do. And so, sometimes moms are like, oh, I got this. This is my third baby or my fourth baby. And then they're like, wait, I just got thrown for a huge loop. I can't do this by myself. But the other thing I really want parents to understand here is that I couldn't make our title any longer and I couldn't be Utah breastfeeding and bottle feeding and tongue tie center. Um, but I mean, so many moms don't think they need to come to us because they're bottle feeding. And I have worked with a lot of bottle fed babies that are tongue tied. And so it doesn't matter. Good oral function is needed whether breastfeeding or bottle feeding. And that's the thing I really hate hearing is when doctors or other providers or grandma, it's like, well, if you're not going to breastfeed, why get the tongue tie fixed? And I'm like, wait, whoa. Like, it's not just about bottle feeding, it's about sleeping and breathing and eating down the road and
Hmm.
speaking and all the other things, right? So I think anybody is an ideal fit for us, especially if you've had, as an adult or a kid, like if you've had problems speaking or sleeping, or, there's like a lot of questions we ask are like, have you had dentist or braces once or twice or three times? Like, do we have a failed orthodontia? Why are we failing? Why are we having to repeat when we can get the teeth all straight? So I don't know if I have an ideal patient. We love everyone who walks through our door. We also do microcurrent neurofeedback here. So we have a lot of kids and adults with anxiety, depression, sleep disorders, a lot of things that we do here. And honestly, everything at our center is mom driven. And that is because as a mom, I realized my kids need neurofeedback. So I called Anne and I was like, hey, I have an idea, which is our code word for like sit down because we're going to change something.
Yeah.
And so I tell her, I'm like, we need to buy this microcurrent neurofeedback machine. She's like, Sherri, because just the day before she had called me and said, I have an idea. We need to do an IV clinic. And I was like, we can't have two ideas 2 days in a row. Um, but we do, and we did. And so we have an IV clinic here. We have so as you know, we have an MD on staff, but we have an IV clinic here. We do a microcurrent neurofeedback as well as lactation, bottle feeding, and then all things tongue tie, myofunctional therapy, speech therapy, craniosacral therapy.
Amazing. Amazing. Such good stuff. Okay. Tell us something that most people don't know that you think that they should know about your services.
Adults need to have their tongue ties released as well.
Yeah.
So I got mine released at 38, changed my life. All six of my kids were tongue tied. And I didn't know it because they have varying symptoms. I have two classic tongue tied kiddos, mouth breathers, poor sleep, poor focus during the day, tantrums, anger when they were little. Um, and anyway, yeah, tonsils out when they were 4 and 5. Just classic tongue tie. And I have others that weren't classic tongue tie, but were tongue thrusters or had, you know, bad breath or things like that. So it's like there's not just one thing that is going to be for sure fixed by your tongue tie, but your tongue affects your whole body. And that's what I wish people would understand. I'm getting my nurse practitioner, and so I'm doing clinicals right now in sleep medicine. And the thing that has been so frustrating for me, like legit had to bite my tongue, is that we have patients coming in and they're getting sleep studies. And this one patient, I just couldn't hold it any longer. And I said, can I look at her tongue and her mouth, please, really fast, actually, before
Like,
she
gotta
goes?
do
Because they were
it.
sending her for a sleep study and she's getting fitted for a CPAP. And the nurse practitioner with is like, of course, Sherri, this is your thing. And I was like, yep. So I sit down to talk to the patient. I said, can I look at your tongue? And she goes, oh, I'm tongue tied. And I was like, you already know you're tongue tied? She's like, yeah. She couldn't lift her tongue past the tip. The tip was stuck to her gums.
Oh,
And she's like in her 50s. And she's like, well, I sleep with my mouth open, I snore, and now we're getting into the comorbidities of high blood pressure and strokes, other things like that that can be affected by poor sleep.
Yeah.
And she's going to have a CPAP because that's the standard of care. But I'm like, we could do myofunctional therapy, get your tongue stronger, release your tongue so it has this right range of motion, get you nasal breathing so that you don't need the CPAP. And not I'm not saying that that will cure everything. And my husband jokes around that I think tongue ties will fix the world, but tongue tie releases, and I don't. But it's not that she might not need CPAP as well. She might
Hmm.
for oxygen and central sleep apnea and other things. But it's just another thing that gets missed, right? And I can't even tell you how many doctors I go and talk to, and they're like, "Wait, what's a tongue tie?" And I'm like, "Oh, okay,
It's
let's
still a lot of
start.
work to
Let's
do.
start at the
Yes.
very beginning."
Yes.
Yeah.
Yes.
So,
Exactly.
which, and it's not their fault. They just didn't get trained on it, right? And it's not within like their views of having any problems with it, right? Because they can speak, they can eat. So for them, they're like, "Oh, I'm fine."
Yeah. I don't need anything. Yeah. Yeah. It's a super great point. Now I need to go get my tongue looked at to make sure. Okay. Is there anything special that you want to promote to the audience watching here? Anything that you have going on? Anything you want people to be aware about?
Yeah. So we're going to be at Be Healthy Utah this weekend,
Coffee.
and we have a booth at the expo. We're giving away a free lactation visit, as well as some other fun prizes and things that we can get that are just going to be fun. So I think that's ultimately what we want is families to be healthy and to start out understanding the oral function that's needed for life, and how it can affect things, as well as just it's going to be a great event. So that's the biggest event we have going on right now. Yeah, I don't think we have anything else, but we always are. We have every so the other thing that I'm really passionate about is that I don't think breastfeeding or bottle feeding support should only be to those who can afford it or have insurance or um, qualify for WIC. There's a lot of people in the middle who don't qualify for WIC or who don't have enough money to have a private consultation. So we have a weekly breastfeeding support group that
Awesome.
is totally free to the public. Like I love for moms to come and get help or do weight checks on their baby. But they have to understand it's a group session. So it's not like it's a little different than the one-on-one hour you spend with me. It's run by our interns. And but it's a lot of it's and it just I think 75% of what I do is telling moms they're doing a great job. I might tweak some things here or there, but you know those postpartum hormones, baby needs to be fed 24 hours a day. Like you just start to think that everything in the world is wrong. And so mostly what we do is support, but
Love
you
that.
know,
Thank you for sharing that. It's a great resource to have. Kate, my favorite question to ask everyone is what do you want to be known for in the world?
what do I want to be known for in the world? Honestly, I just want to be known and remembered for being compassionate and supportive and caring. Like in the medical world that I've been in for a long, long time, um, I have had the people who have imprinted on me and on my heart and have helped me through some horrible things. And they just kind of stay with you forever. And that's like, we just love being a part of people's journeys in finding good help, whether it's tongue tie myofunctional therapy or other things that we do, like the craniosacral therapy or the neurofeedback. We want to be a resource for parents and families to be able to help people. I had one patient that was a little 3-year-old and had been taken to the doctor every 6 months because of drooling and had two speech therapists. They were going to two speech therapists, had been to the doctor every 6 months for drooling. They came into me and I was like, lift your tongue up. And he was so tongue tied and had been missed. And this poor family had been struggling for so long. And I was like, well, let's talk about this. Let's figure out, best the best scenario for each patient is very different. Sometimes it's, hey, we need to wait a little while and do some other therapy before we release it. And other times it's like, wow, we can release this like today. Um, so there's a lot that goes into it. And I think people don't realize that, especially as kids and adults. You're doing weeks of myofunctional therapy before the tongue tie release, and then you're doing months of myofunctional therapy after the tongue tie release. So it's not a quick fix.
Mhm.
And if people aren't willing to put in the time and energy, then we're not the place for them. Because I now know there's a right way to do it and a wrong way to do it, and I refuse to do it the wrong way anymore.
Right.
So it's kind of it's been a learning curve for sure, and we're learning every day and we're changing all the time. And that's, I think, the hardest part about the tongue tie world is, when I started this 5 years ago, it was like, don't suture, leave everything open. And then all of a sudden now it's like suture. And then all of a sudden it was like less sutures, some glue. Like every time we go to the conference for
Different.
the
Yeah.
updates, because so we go to it for every year for the updates, there's something new. And so we're like, okay, we're going to change this, so if you worked with me 10 years ago or 5 years ago and I was doing something different, it's because I learned something new and have a better way, right?
Yep.
And so we're always just trying to improve on what we can.
Love that. Okay. Where can we find you? Where are you located? Website, socials, all the things.
Yes. The longest ever is utahbreastfeedingandtonguetie.com. Double check it because you're going to miss a letter or put a wrong one in. You can call us at 801-923-4122. We're located in Bountiful off of 4th North, and we share the space with the midwives. So they have a birth center in the basement and share some office space. But that's where Utah Breastfeeding and Tongue Tie is. You can also send us a text on that. But if you want to come in for a consultation and see kind of what's going on and an assessment, we're just happy to help.
Amazing. Thank you so much for taking your time today, Sherri, to be on our Spotlight series. It's been a pleasure chatting with you,
Awesome.
and thank you for all that you're doing in the community here.
Oh, it's been great. Thanks for asking all the fun questions. I could talk about this forever.
Yes, absolutely.